HIV/AIDS is a major public health issue in Botswana. It's also a development concern. That's why we've chosen HIV/AIDS as a sector that will focus in regarding unilateral intervention. Just to give a background of the HIV/AIDS situation in Botswana, I'll give a bit of statistics. In 2008, there was a survey that was conducted by the government of Botswana. And according to the Botswana AIDS Impact Survey conducted in 2008, about 17.6% of the total population are people living with HIV and AIDS. And this makes Botswana one of the worst HIV-affected countries in the world. And the recent data on HIV in Botswana also indicate that women are more susceptible to HIV infection than their male counterparts. This is really a concern, especially when we are talking about issues of gender and HIV/AIDS. This will bring us to discuss the issue of having to integrate or to promote gender equality in all our HIV/AIDS interventions in the country. Bias 3 also, again shows that females have a relatively higher prevalence rate of 20.4% compared to male counterparts having about 14.2%. And violence against women and abuse of power and money in sexual relationship are also believed to be placing women at an increased rate of HIV/AIDS infection. I mean, with this background, it shows us how bad the situation is when it comes to HIV/AIDS in Botswana. One may also ask themselves, why do we have such high infection rates in Botswana? What makes HIV/AIDS to be a huge issue in Botswana? Among the many factors contributing to the rapid spread of HIV/AIDS infections are issues of multi-concurrent partnerships or sexual partnerships, issues of intergenerational sex, high population mobility, issues of shifting social and cultural norms, including stigma and gender and equality issues. The government of Botswana has scaled up its endeavors to meet the challenges posed by the epidemic, and in terms of the national response is characterized by specific programs that intend to enhance prevention activities, that intend to provide treatment and care and support to those who are affected. Among the many programs, there are programs such as the prevention of mother-to-child transmission, that is PMTCT. There is provision of antiretroviral therapy. There is provision of preventative therapy, that is SONZ preventative therapy. And there is other programs such as community home-based care and programs for orphans and vulnerable children. I mean, there are lots and lots of programs that the government has started in order to address the issue of HIV/AIDS, in order to prevent HIV/AIDS and to provide support and care to those who are already affected. Although Botswana is doing very well in terms of the national response or addressing issues of HIV/AIDS in the country, there's a realization that there are still some challenges, especially when it comes to implementation of programs by the different stakeholders that have been called on board to work alongside the government in terms of addressing HIV/AIDS. Some of the challenges that our partners or the civil society organizations are facing in Botswana are issues of governance and leadership, issues of financial management, human resource management, strategic and operational planning, and monitoring and evaluation, including coordination and networking. And this is where WUSC or UNITERA comes in. It helps partner organizations by building their capacity to address the challenges that I've already mentioned. You find that most of these challenges, they just revolve around aspects of institutional and technical capacity. So UNITERA in Botswana has chosen to focus in 2 priority areas. These are the priority areas that we agreed upon, by both UNITERA office in Botswana and the partner organizations that we are working with. And the first priority issue is that as UNITERA in Botswana, we are going to support the partner organizations in issues of communication, specifically focusing on HIV prevention among the youth. That is support to communication for preventing HIV/AIDS among the youth. One may ask themselves, why HIV prevention? Why HIV/AIDS communication? Why do we focus in those areas? We do focus in these areas because our partner organizations reported that they've realized that there are a lot of messages that are being given regarding prevention of HIV/AIDS, but most of those messages, or some of those messages, they are not targeted to specific groups, the different groups that we have in the country. They are not, the messages are there, but they don't really communicate. That's why the partner organizations felt we need to strengthen that part. We need to make sure that our messages are targeted to the different groups that we have. Through that initiative, we also want to help our partner organizations to document, or to document their activities, or to encourage them to document the best practices, and encourage them as well to share knowledge amongst themselves, between other partner organizations in areas that they find interesting, or that they think other people can learn something from. And the second priority area is strengthening the capacity and providing technical assistance in areas of organizational management, in areas of program management, networking, knowledge sharing, and including gender inequality. So we also strengthen the capacity in issues of policy dialogue. So that is just to give an overview of what we are doing as UNITERA Botswana, and what areas are we involved in through our volunteers as UNITERA Botswana.